Hi, it's Dr. Jen, and welcome back to Celebrity Review. Today we have Scott Disick, and this isn't like a case of before and after bad cosmetic work. This is a case of before and after Ozempic, and we're going to talk about that. So you can see in his before picture, he has a nice, full, youthful face, like a normal face. Good-looking guy. In his after picture, he looks like he has wasting. I'm not saying that he has HIV at all, but it looks like an HIV wasting face, like completely skeletonized. So this is weight loss gone too far. The show has alluded to the fact that he's on Ozempic because it shows it in his fridge during filming. He needs to be monitored medically because this has gone way too far. I would not let a patient. Goes as far as unhealthy. So you can see in the temples, he's skeletonized. In his eye socket, he's skeletonized. Underneath his eye, even his nose looks skeletonized. His lower face is caving in, skeletonized. The whole thing. And we need to talk about this. We're doing this a little differently here, because it's not Ozempic that's causing this problem. It's the drastic weight loss. So even if you just starved yourself, not saying to do that, don't do that, but it would cause the same thing. So this is drastic weight loss, which is causing it, losing all the fat in his face. And you guys can notice actually that his skin looks a lot worse. Here it looks very young and youthful and plump, and it looks like more hanging, 90-year-old man in the after picture. We need to remember that stem cells, a great place where we get stem cells from, a majority of them live in your fat cells. So the fat cells in your face are actually providing stem cells to your skin. That's why when you lose fat, you get a lot of loose hanging skin because of the volume loss and because of the stem cell loss. So with him, I would actually recommend that he starts gaining some weight. Cosmetically, we can fix the face, this face, and we'll talk about that in a second. But Ozempic, tirzepatide, all these weight loss medications can be very good for people because they do need to lose weight. When you see it in your face and you actually need to address it, there's things that we can do. We can inject exosomes, we can inject Renuva, we can inject Sculptra and filler. We can tighten the skin with lasers and microneedling. There's things that we can do to address the youthfulness of a face if you need to lose weight, because it's healthy to lose weight, and then we can address the face. But in this face, let's look at just some key things that happen with volume loss. We can say as we age, because this is like rapid aging, and I'll tell you why. Because you guys see in his temples how before he has a full temple, he does have his brow sloping down, but you see how as he loses a bunch of volume here and skeletonizes in his temples, how his brow drops drastically now. That's why when we do temple filler, it does pop your brow up. So I always tell people that, yes, we want to correct the temple. We want to correct the temple so it looks nice and flush again like it did in the before picture. But that will also pop your brow up as well, which is a good thing. For the under eyes, you guys see this here. He has a nice full, very natural under eye. And in the after picture, completely skeletonized. So we would add filler. I would add exosomes as well, injectable. I just put them on my eyes. I'm super happy. So to get back some of those growth factors, exosomes are molecules that tell your stem cells what to do. So they're like messengers. So stem cells aren't actually legal in the United States. Exosomes are. So we can inject exosomes at this time unless we harvest your own stem cells. So we do filler underneath the eye here, and then we would Sculptra the mid and lower face. Or if you don't want to do multiple, like an HIV wasting to treat this, we use Sculptra. I used to treat those patients at no charge, but we don't do that anymore because of regulations. So you just do multiple sessions of Sculptra, or you can do 1 to possibly 2 sessions of Renuva, and then it's a more permanent for the lower face, and that would look really good to correct this. But I'm not saying that he should stay this thin. He needs to gain weight and talk to his doctor. And then I would microneedle with radio frequency to tighten the skin up, and you can do that even if you're on Ozempic or you've lost weight and you have loose skin, we can tighten that all up with microneedling with radio frequency. It's amazing. Scott, we hope you're doing okay, and I hope that we can get this handled medically or your doctor can get this handled medically for you. But we're rooting for you, and yeah, I don't want to see you like this. Thanks so much for watching. Let us know who you want to see next in the comments below.